In Cushing disease, this happens when an adenoma, benign tumor in the pituitary gland, makes too much adrenocorticotropic hormone or ACTH. This causes the adrenal gland to make too much cortisol. Symptoms include a round face, thin arms and legs, severe fatigue and muscle weakness, high blood pressure and high blood sugar, purple or pink stretch marks on the skin, and weight gain, especially in the abdomen. Cushing syndrome can be caused by overuse of cortisol medication, as seen in the treatment of chronic asthma or rheumatoid arthritis. Iatrogenic Cushing syndrome, excess production of cortisol from a tumor in the adrenal gland or elsewhere in the body. Ectopic Cushing syndrome, or a tumor of the pituitary gland, secreting adrenocorticotropic hormone, ACTH, which stimulates the overproduction of cortisol from the adrenal gland. Cushing's disease. Cortisol is a normal hormone produced in the outer portion of the adrenal glands.
Attributes. Too much cortisol can produce some of the hallmark signs of Cushing syndrome: a fatty hump between your shoulders, a rounded face, and pink or purple stretch marks on your skin. Cushing syndromes can also result in high blood pressure, bone loss, and on occasion type 2 diabetes. Risk factors. Tumor removal may lead to full recovery, but there is a chance of recurrence. Survival for people with ectopic tumors depends upon the overall outcome associated with the particular tumor type. Untreated Cushing syndromes can lead to death. Complications: diabetes mellitus, high blood pressure, serious infection, fractures due to osteoporosis, kidney stones, enlargements of pituitary tumor.
Prevalence: an estimated 10 to 15 million people are affected every year. Pituitary adenomas or Cushing disease account for more than 70% of cases in adults and about 60 to 70% of cases in children and adolescents. The signs and symptoms of Cushing syndrome can vary depending on the levels of excess cortisol. Common signs and symptoms of Cushing syndrome are the following: weight gain in fatty tissue deposits, particularly around the midsection and upper back, in the face or in moon face, and between the shoulders or in buffalo hump, pink or purple stretch marks on the skin of the abdomen, thighs, breast, and arms, thinning fragile skin that bruises easily, slow healing of cuts, insect bites, infections, and acne.
Signs and symptoms: women with Cushing syndrome may experience thicker or more visible body and facial hair or hirsutism, and irregular or absent menstrual periods. Signs and symptoms: men with Cushing syndrome may experience decreased libido, decreased fertility, and erectile dysfunction. Other signs and symptoms that may occur with Cushing syndrome: severe fatigue, muscle weakness, depression, anxiety and irritability, loss of emotional control, cognitive difficulties, new or worsened high blood pressure, headache, increased pigmentation of the skin, bone loss, leading to fracture over time, and in child, impaired growth.
Cushing syndrome can be difficult to diagnose, particularly endogenous Cushing syndrome, because the other conditions share the same signs and symptoms. Diagnosing Cushing syndrome can be a long and extensive process. First, urine and blood tests. These tests measure hormone levels in your urine and blood and show whether your body is producing excessive cortisol. For the urine test, you may be asked to collect your urine over a 24-hour period. Saliva test. Cortisol levels normally rise and fall throughout the day. In people with Cushing syndrome, levels of cortisol drop significantly in the evening. By analyzing cortisol levels from a small sample of saliva collected late at night, doctors can see cortisol levels are too high, suggesting a diagnosis of Cushing syndrome. Imaging tests. Computerized tomography or CT scans or magnetic resonance imaging (MRI) scans can provide images of your pituitary and adrenal glands to detect abnormalities such as tumors. Petrosal sinus sampling. These tests can help determine whether the cause of endogenous Cushing syndrome is rooted in the pituitary or somewhere else. For the test, the blood samples are taken from the petrosal sinuses, veins that drain the pituitary gland.
Classification of disease. Cushing disease is a specific type of Cushing syndrome. It occurs when a pituitary tumor causes the body to make too much cortisol. Cushing disease is the most common form of endogenous from the body Cushing syndrome and makes up about 70% of Cushing syndrome cases.
Medical or surgical management. Ways of treating the disease. Transsphenoidal removal of the tumor is the treatment of choice for Cushing disease. Cure is like weeks after the surgery, and most patients are rendered hypoadrenal for months to years after the procedure. Surgical and pharmaceutical interventions. Cushing disease is a rare disease in which the adrenal glands make too much of the cortisol hormone. Isturisa is the first FDA-approved drug to directly address this cortisol overproduction by blocking the enzyme known as 11-beta hydroxylase and preventing cortisol synthesis.